the company is called Cision Vision, and then yeah, as we kind of talked about, it's a MIT spinoff based on this technology that I invented at MIT, and then so this is actually an image of lymph nodes and lymphatic vessels. So this is actually the image that I showed Professor Rob Cottrell. And then that was the pivotal moment that we started the discussion. So as you can see in this picture, you can see the clear border between lymph nodes and fat, and also lymphatic vessels. So this is a rodent mesentery, and then you see these are mesenteric lymph nodes of rodents. Yeah, so what our technology can do is basically see lymph nodes as the opposite color. And then, yeah, so in this video, you're seeing basically a human axillary lymph nodes, which are obviously important in the context of breast cancer. So this is just to demo that we can see how well we can see the lymph nodes. And then also, we are developing a artificial intelligent algorithm to basically not only detect and also measure the size of lymph nodes. So basically, instead of just showing you these pictures, we can also just let AI point to the lymph nodes for you. So then in this case, in the case of pathology, we can save time even more. And then in the case of surgery, then we actually can help surgeons save time and help them find more lymph nodes during the procedures. So yeah, so that's the data that we have. And then so in terms of the demo I was talking about, so there's this animation here. What we're envisioning this product to do is that it will be, as I said, it's a shoebox, a women's shoebox size. So pretty slim, and then you can fit it on any table. And then basically at the time of gross examination, I understand there's usually a step called bread loafing. So you cut it into thin slices, and then you start palpating on these bread loaves. But then instead of palpating, which we understand to be sometimes as long as an hour and a half, we basically say now you can place these individual bread loaves onto the imaging window on top of this shoebox design device. Then immediately you will see these really high contrast images showing you where the lymph nodes are. And then if you don't see something like this, you can just simply move on to the next loaf. Then this way you can do this job much quicker than before. So actually, this is the value propositions that we think that is we're offering to pathology assistant and also pathology labs in general, I guess, is that so first of all, we can improve the quality of care by increasing the number of lymph nodes. As we mentioned, that the more lymph nodes, the better the survival rate in the case of colon cancer. But yes, we don't have the quantitative data to say we actually improve survival rate by this much. How much does that change the cancer rate staging results? All these kind of claims for clinical results are still premature, and we are actually, again, looking for clinical collaborators to basically explore these possibilities. But then intuitively speaking, we definitely can find more, help find more lymph nodes, and then that will be a good thing for PAs and then for patients. And then also we can help save costs, that part. So by saving time first, shorten the time of this procedure, that is pretty self-explanatory. But then the second part is that we can actually reduce the amount of false positives that get submitted as lymph nodes. So I read on CAP's website, though, it is actually quite common for PAs and I heard especially resident pathologists to submit FAT and then say, it's so hard, I can't find anything, just submit FAT and call it a day. So then we can reduce that. So basically anything that just not show up as lymph nodes, you don't have to submit it. So it saves the material costs and then also the time of the pathologist to look at FAT. And then for the third one is to increase the revenue for maybe some high volume pathology practices. If you have more cases that you can take on, now you can take on more cases than before. And then the last one is very fascinating. I really would love to know your insights on this, because one thing that I kept hearing about is that actually the number of lymph nodes can be a tension points between surgeons and pathologists,
Yep.
and sometimes even between the hospital executives and these accreditation bodies. Basically, the idea is that it is used as a quality metrics, so that if the number of lymph nodes is not met, it does not meet the requirements, then the surgeons are held accountable. Then the surgeons go to the pathology suite, and then they will have this kind of argument. And usually the PAs or pathologists will need to dig out the tissue and do it over again. So that's what we heard from our interviews, and then we want to basically minimize that and or say eliminate that altogether. So we think these are the value propositions, but then we're trying to we're in the middle of quantifying all of that, and then so that's something that we really hope we can work together with our early adopters to quantify these basically benefits of using our device.
Yeah, I have heard of some surgeons that say that if the report doesn't show a certain number of lymph nodes, that like the patient's insurance won't cover the surgery, or won't cover it as much or something like that. And it is a quality metric for pathology, for surgeons also.
Yeah,
So you're absolutely right in that respect. As far as like your clinical sites and early adopters and things, what would be required of those sites?
Yeah, so I would say nothing is really required. I would say I'm more focused on the people who I'll be working with, and then so in terms of the how to get it done quickly and effectively, I'm thinking that I would love to, if it's possible, I'd love to start with someone local. Hopefully, if someone I can find in the Bay Area, on the West Coast, I can just go do a lot of problem solving on the side. That would be the most ideal. And otherwise, I can also fly. Now it's open, it's possible, but then there's no particular requirement in terms of who just I guess more specifically, just whoever who's really passionate about this project is something that I would say is the number one requirement. And then other than that, I would say I don't really have any requirements.
Okay, I see. Okay.
Yeah.
And then as far as the machine itself, like what are the dimensions of, especially like the screen part of it, I guess?
Yeah. So right now we have it is actually 12-inch screen that we have at the moment. But
Okay.
then this is something that we can easily swap out with some a smaller screen, a bigger screen, and then so the other part is that actually I have a slide for that. Um, yeah, it is not in here, but then so the device part is about the size of a women's shoebox, and then on top of that there's a 12-inch screen.
Okay. Okay, that
Yeah,
makes sense. Okay. So then, and then as far as like after you're done with the thing, how do you clean it, I guess? Because that's kind of a
yeah.
concern.
I know. Yeah, that's a great question. So that's something that we kept hearing from PAs as well, is the how do you clean it? So the idea is we want to make the entire box flush with like all the surfaces are flush. So basically, you just wipe it down with alcohol wipes or any kind of cleaning protocol that you have in your lab already. So there's no gaps that would have residual tissues, which was a concern for other designs that we previously had. So basically, you can just wipe it down with any kind of cleaning protocol that you already have.
Oh, okay. Okay. That's
Yeah.
very convenient. All right.
Yeah.
That sounds good. And then you said, as far as like the bread loafing, I think you mentioned like they have to be a certain number of millimeters thick.
Yeah. So basically, what I based on my interviews, correct me if I'm wrong, and you're definitely the expert in this field, is that I understand that usually these are the bread loaves are on the order of 2 to 3 millimeters.
Yeah.
So then what we can see is we can see through about 2 to 3 millimeters already, and then. And even if someone happened to be cutting it a little bit thicker on the order of 4 millimeter, then all we ask is to you flip it around and then you squeeze it a little bit as well. Then you can, so you will see both sides. And then, so that's all we're saying is that it can see through about 2 to 3 millimeters. So so as long as the tissue is not thicker than 4 to 5 millimeters, then it is we can detect the lymph nodes.
Okay. And is there like like how small of a lymph node can you find with this thing?
Yeah, yeah. So we basically engineered it. So okay, so the technical answer is that we can actually change it pretty easily in the back end if you say you want to go bigger or smaller. But then based on our interviews, is that we heard that the smallest one is usually on the order of 1 to 2 millimeter, and
Yeah.
then so for us, we can definitely see that. So the whole, so we can detect lymph nodes as small as 1 to 2 millimeters. And then we actually made sure that these 2 to 3 millimeter lymph nodes are not just 1 to 2 pixels on the in the picture. It's actually a significant amount of signal, and you'll be able to see it. So we optimized that.
Okay. Okay.
Yeah.
Yeah, that'd be really helpful because it's those millimeter lymph nodes. Those are the hard ones to find.
Yeah, yeah, yeah. So definitely. So we definitely had that in mind that it has to be a magnified image. It can be just the same kind of resolution or a magnification that you see with your eyes. So what was actually a little surprising to me is that actually you can see here we have the regular image and the and our image side by side, and then actually there's a lot of information in the regular image as well when you magnify it, because you can actually kind of see if it's there's hemorrhage going on, and then sometimes there's hemorrhage inside lymph nodes, and actually we can see some information even just for the magnified image. But of course, in terms of finding lymph nodes, our magnified image, this proprietary image, would be extremely helpful.
Mhm. Okay. Okay. Yeah, that makes a lot of sense. All right.